Thank you, Srividya. It gives me great pleasure to introduce Dr. Pranisha Gautam Goyal, who is an infectious disease specialist affiliated with Northwell Health Division of Infectious Disease. She is an attending physician at the North Shore University Hospital and Long Island Jewish Hospital. Dr. Pranisha is also currently the assistant professor at the Zucker School of Medicine at Hofstra, Northwell Medicine. She is an active member of the American College of Physicians and the Infectious Disease Society of America. This young physician has held various administrative leadership positions, including the chair of the EPIC Antimicrobial Stewardship Specialty Work Group, Northwell Health. Under her leadership, North Shore University Hospital was awarded the Antimicrobial Stewardship Center of Excellence designation by the Infectious Disease Society of America, IDSA. She has published several research papers and is a reviewer for multiple scientific journals. Dr. Gautam Goyal graduated from Rabindranath Tagore Medical College, Udaipur, with MBBS degree and completed her residency in internal medicine at the New York Methodist Hospital and a fellowship in infectious disease at the North Shore University Hospital. Dear friends, now I present to you this young dynamic physician, Dr. Pranisha Goyal.
Thank you for the kind words, Dr. Sai. So without further ado, I'm going to get started. Can everyone see my screen? Okay, so today we are going to talk about the common respiratory viruses we see during the season. And basically what these include is the flu, the COVID, the RSV. These are the viruses that commonly circulate during the season. So the objective of the talk today is to review the burden of these viruses in our community, to assess the epidemiology of these viruses. And then I'm just going to go over the updated vaccine recommendation and the respiratory illness guidance. So as I mentioned before, the big three, it's COVID, flu, and RSV. We'll start with COVID-19. So as you guys all know, COVID can present in multiple different ways. You can have fever, cough, runny nose, shortness of breath, headache, sore throat, loss of sense of smell, and many others. In the beginning of the pandemic, the way we used to track the prevalence of these viruses was basically following the hospitalization records. And also we used to measure the data from the commercial labs during their testing. But all of this has changed over 5 years because most of us now test through the rapid tests that are available at home. So no more like a lot of commercial lab testing that is required anymore. And the second thing is also the reporting requirements for a lot of hospitals have changed. So this measure is not accurate anymore. So what do we do to figure out how we are doing so far? So what we do now is wastewater surveillance. And this is basically just a graph of wastewater viral activity in the United States. And as you see, this goes from 2022 till January of 2025. And we are actually at the tail end of the infection for this season. So there's two different ways to handle a viral infection. One is a preventive measure. So meaning how can you prevent from yourself from getting the infection? And the second one is treatment. Unfortunately, for most of the viruses, there's no treatment except like the COVID and flu. So the thing that you can do actually is to prevent yourself from getting it. And how do you prevent yourself from getting these infections? And that's mostly by the use of vaccines. We have a lot of vaccines for the common viral infections that is available. So as you guys all know, for COVID-19, we have two different kinds of vaccines. One of them is mRNA vaccine from Pfizer and Moderna, and the other one is protein subunit vaccine from Novavax. So the updated vaccine is recommended for everybody that is 6 months or older, and it targets the most recent variants. There's always a little lag between the variant and the vaccine that is formed because the COVID changes so much, but the efficacy stays almost similar. And basically, most of the vaccines, what they do is they do not prevent you from getting the infection, but they reduce the severity of your illness, meaning you don't get as sick as you would if you didn't get the vaccine. So it also prevents long COVID that you might have heard a lot in the papers and in the publications. So the vaccine also prevents you from getting long COVID. What about the treatment? If you do get the infection, what can you do? There are three different treatment options that are available. The first one is commonly called Paxlovid. It is approved for children that are 12 years or older. And most of these treatments, the sooner you start, the better it is. So most efficacious if you start within first 5 days of you starting to have symptoms. The good thing about Paxlovid is it can be taken by mouth, so you can take it at home. The one of the problems with taking Paxlovid is if you are on a lot of other medications, like for cholesterol, blood thinners, then there can be an interaction between Paxlovid and those medications. So always talk to your doctor before taking the Paxlovid. The second option that we have is remdesivir. Same thing, it is approved for adults and children. Start as soon as possible. The only caveat with this medication is that it's only intravenous. So either you go to the hospital to get it, or you have to set up an infusion company and try to get it at home, which can be a little bit burdensome. The last but not the least is molnupiravir. Not as effective in comparison to the other two options, but it's still approved, not as many interactions though. But based on the most recent studies, it's only like 30 to 40% efficacious. But it does, you can take it by mouth, so you can take it at home. Where do you look for updated information? For what is happening across United States, I recommend that you go to the CDC website. And for figuring out what's happening in New York State, please use the New York State Department of Health dashboard. Next up is influenza. It's been around for a very long time. We all know about it. This is basically just a trend of influenza across the United States. This is updated until January mid, where we were still seeing a little uptick, but by now in mid-March, we are already starting to see a decline in the rates of influenza in the community. The symptoms, same thing like COVID, very similar. You know, it can cause fever, cough, sore throat, stuffy nose, body aches, muscle aches, headaches. Some people can get diarrhea. And same thing for prevention. We have a vaccine, which basically is decided annually. They pick based on how the activity of the different flu viruses is, and they pick a vaccine based on that. We have the vaccine available since September. It targets 3 different strains. And with other vaccines, it does not prevent you from infection, but it does reduce the risk of severe illness or death from COVID. One other caveat I would mention is if you're 65 years of age or older, you should be getting the higher dose flu vaccine. Unfortunately, the flu was much more prevalent in the community this year because the vaccine was only 40% effective. What about the treatment? If you do get it, the treatment is Tamiflu, the common name for oseltamivir. So the treatment is indicated for you if you get the infection, and for the family members, that live with you, they should get prophylaxis. The next one is RSV. And RSV normally is a virus that normally presents with shortness of breath, like cough that lasts for a very long time, a lot like bronchitis-like symptoms. It is a leading cause of acute respiratory infections in young children. And in the pediatric group, meaning the children, the rate is estimated to be 30 million cases and 3.6 million hospitalizations. So a really big number, especially in children. For adults 65 years or older, it is around 60 to 160,000 hospitalizations. And the mortality can be high, like up to 100,000 per year worldwide. Again, this is basically a graph that can show you the activity of RSV during the season for United States. As you see, by mid-January, we're already heading out of the season. So the activity is declining. So which population is at high risk for getting severe infection with this virus called RSV? So it is premature infants, so meaning that are born prior to full term, or infants that are less than 12 months of age, children with weak immune systems, and then children who have chronic lung diseases, or they're born with heart problems. How about adults? So the population that is at higher risk for severe RSV infection is people that are 75 years of age or older, and then the people with weak immune systems. So this is just a list of all the medical conditions that put you at high risk for severe disease with this virus. So if you have a chronic lung disease, you have heart problems, you are somebody with moderate to severe compromise in your immune system, you're diabetic, obesity is one of them, neurologic or neuromuscular conditions, if you have kidney problems that are chronic, liver problems, blood issues, hematological conditions, and some other medical conditions. So now actually we have a prevention for RSV, and there are two different vaccines that got approved for RSV recently. One of them is Abrysvo. It is approved for patients more than 60 years of age and pregnant women. So for basically for RSV, only one dose is recommended. So you don't get any boosters or anything for RSV at this point. The other one is Arexvy. Same thing, it's approved for age more than 60 years of age, but not pregnant women in this for this vaccine. So what are the recommendations for regarding the vaccines in these in patients with RSV? So it is recommended for infants, pregnant people, and older adults. What does infants mean? Meaning infants less than 8 months of age. So kids that are less than 8 months of age during their first RSV season. And then children that are 8 to 19 months who are at high risk. Then pregnant women between 32 to 36 weeks of pregnancy during the months of September and January. And as I mentioned before, only one dose at this time. For adults between 60 to 74 years of age, it is only indicated for people that are at high risk. So the medical conditions that I went through with you guys before, and anybody who is more than 75 years of age, one dose is recommended at this time. So the vaccine, the study that got the approval for this vaccine, almost 146,000 people did get vaccinated. And it showed that the effectiveness of vaccine was around 78%. And it actually also reduced the RSV-associated emergency room visits by 79% and hospitalizations by 80%. So very effective vaccine based on the study. So, which are the vaccines for the respiratory viruses, like the common viruses that you should get as an adult? So, yearly COVID-19 updated vaccine, even if you had prior vaccines or boosters, you should get a flu vaccine every year. RSV for adults 75 plus years, but it's only one time. And then, as I mentioned, RSV for 60 to 74 if you're at high risk. And then there are other vaccines that you might be approved for or should be getting, like shingles and stuff like that. But I would say talk to your doctor about all the other vaccines that are recommended for your age group. What about the children? What viral vaccines they should be getting? So for children 6 months or older, you should be getting the COVID-19 vaccine, the annual flu vaccine, and if the kid is less than 8 months, then they should get the RSV vaccine. And same thing, talk to your doctor about the other vaccines for the age group of your child. What do you do in terms of prevention when you do get an infection with these respiratory viruses? So I suggest most of these viruses are spread by droplet. So meaning you cough, you sneeze, you blow your nose, you basically aerosolize the virus, and other people that live with you in the home, they can inhale it and they can get infected. So I would suggest stay home, don't go to work, and try to stay away from family members if you can. Wear a surgical mask so the other people in the home do not get infected. And do not go back to work until both of these things are true. Your symptoms are getting better, so you're feeling better overall, and your fever has resolved without taking any medications that reduce the fever, like Tylenol, Advil, Motrin, any of those things. And then for the next 5 days, after you're already starting to feel better, continue to wear the surgical mask, because a lot of times you do start to feel better, but you can still shed the virus. So even a little cough, lingering cough that you have after these infections, or a little stuffy nose, you can still infect other people. Wash your hands often, fresh air, hydrate yourself. All those things are important when you're trying to recover from these viruses. This is just my last slide. Basically, this is showing the activity of the different viruses. Same thing, this is updated until the end of January. Here it says flu is high and climbing, but as we all know, by end of mid-March, it's already starting to decline. Still a lot of flu out there, but not as much as it was mid-January. COVID, again, it's starting to decline. RSV, same thing, it's low, moderate, and declining. Norovirus is still out there. Norovirus is not a respiratory virus. It's more like a diarrhea causing an infection. It's also a virus, but it's still circulating enough in the community at this point. So that is it from my side. I thank you all for listening to me.
Thank you so much, Pranisha. I'm sure the audience has several questions on their behalf. I would just pick some of the important ones and ask you. To begin with, I know during your presentation you have mentioned about the vaccines. Most of the patients, what they ask, and almost on a regular basis, why do I have to take a vaccine if I'm going to get the flu anyway? What would your answer be?
Yes, that is what I also get a lot of times when I'm practicing. But as I mentioned before, yes, you can still get the infection, but you don't get as sick. You might not need to go to a hospital with these infections. So that is the benefit of taking the vaccine. That your symptoms will be much less severe, and they last less longer than they would usually.
So it would be just a mild cold or cough and it'll go away. There's no guarantee when you take the flu vaccine that you're not going to get the flu. And we keep telling them, but yet. Now, what would your advice be for patients who are totally against? There's a big what you call, like almost there's a group of people who are anti vaccine. And how would you educate them for the pros and cons for the importance of vaccines, especially for the COVID and flu, which can be spread so frequently and so easily?
So at this point, both for COVID and flu, we actually have a lot of data. Flu vaccine has been around for many, many, many years. There was a little caveat in the middle where they said, oh, egg allergy, don't take it. But now, actually, that's also not true anymore. And it basically, like, unless you have anaphylaxis to egg product, then that would be the only indication not to take it. Flu can make you really sick. So if you can prevent yourself from getting sick, and instead of being sick for 7 to 10 days, you can be sick only for 3, 4 days or 5 days. I would take it. And most of the times, the side effect of the flu vaccine is not that much actually. You might get like a sore arm, maybe a little bit. Sometimes people can get like little flu-like symptoms, but they get better within a day or two. So definitely not much better than getting the flu itself. And then once you get the flu, you actually put your family members at risk for getting the same infections. A lot of times it might be elderly people that are living with you and they can get very sick with it. So I would definitely suggest you should get the vaccines. Same thing with COVID. There's a lot of issues about COVID vaccines, but there's millions of people that have been vaccinated with COVID. And as I mentioned, one of the major benefits of COVID vaccine is also long COVID. It prevents you from getting the long COVID, which is getting more and more of a real diagnosis. Same thing, prevent you from being sick and preventing your family members and loved ones from getting sick. If you can do that, I would take it.
That was very useful, Pranisha. Also, could you tell us what this long COVID is? Because we see a lot of patients and they somehow attribute, because they got the vaccine in the past and they had the COVID and they're still suffering. So, how do you explain the long COVID? And is there any newer developments in treating this long COVID?
So long COVID is basically those subset of people that basically have the symptoms of COVID last much longer than the regular 7 to 10 days. So like fatigue, shortness of breath when they're exerting themselves, like this lingering cough that doesn't go away. Those are the symptoms of long COVID, and that can last for many months, sometimes a couple of years also for some people, especially the ones that got infected in the initial part of the COVID pandemic when it started, because the virus itself was very, very serious and that deadly at that time. Now the virus is
Less virulent.
serious and virulent, but it's just like more easier to spread in comparison to the original virus. So that's what long COVID is. Unfortunately, not much treatment for long COVID. So the treatments that are available do not protect you from getting long COVID, but the vaccine might. So that is basically what we have available for long COVID at this point.
See, now the pharmacies and the pharmaceutical companies almost have taken over. So the CVS will kind of almost harass you to come and get a vaccine. And is it really the right thing to get multiple vaccine at the same time? Most of the patients ask, and they just say, oh, you can get 2 or 3 at the same time. And I remember a patient going to the emergency room because they gave her 3 vaccines the same day. So what would your advice be in that particular situation?
So there are a lot of studies actually done to see if you can give a couple of vaccines at the same time. So like the flu, COVID, they can be actually given at the same time. Flu, RSV can be given at the same time. And I do know that people can get side effects, especially like the patient that you mentioned got 3 different vaccines at the same time and got sick and got hospitalized. There's always exceptions, but most of the times they're safely administered without much side effects. Yes, your sore arm might be much more than if you get just one vaccine. You might feel like little fatigue, low temperature, and flu-like symptoms, but most of the times they can be administered safely. I would say though, like, don't take it if you're feeling under the weather or sick, then try to wait a few days until you're starting to feel better and then go for the vaccines.
Yeah, I think to be on the safe side and not to get into some kind of confusion for the patients, I always say at least have 2 weeks apart because they do get sick when they get multiple vaccines at the same time. I mean, I know there's no studies to actually prove otherwise. And are there high risk adults less than 60 years, other than pregnant women, who should be considered for the RSV vaccine?
Yeah, so that was the slide that I went through,
Yes.
which says the chronic medical conditions. So the heart, kidney,
Yeah,
chronic
that whole
kidney
list
disease,
that
all
you
those. Yes,
presented. Yes,
exactly. Those are
yes.
the high risk patients that should be getting the RSV.
So, are there any differences reported? These are questions from the audience. Differences reported between the approved vaccines for COVID in terms of effectiveness and safety profile?
So for the mRNA vaccines, both of them actually equally effective. The side effect profile is not very different. For the Novavax, there is, I think it's still 70 something percent effective. So still like pretty potent. The side effect profile is a little different just because of it's a protein unit versus an mRNA vaccine. But most of the people, even with the mRNA or Novavax, will have the same side effects.
But the most effective one, do you think, is Pfizer? Now, talking about companies, is there a difference?
Between no,
I know Johnson and Johnson is really not very
it's
popular,
out
but
now. Yes,
between Moderna and Pfizer, there's no difference,
no
correct?
difference between both of them.
And could you comment on, because we come from an Indian background, the way they kind of developed the vaccine so quickly, and it was so effective for like huge population benefit, and we actually, the Indian Prime Minister shipped out a lot of vaccine. Can you comment on that vaccine that was prepared as an urgent situation? And I think kudos to the Indian government to come up with such a fast track thing, for our population there. Initially, they had suffered a lot. Do you have any comments on that particular vaccine?
So yes, it was very effective. I think by the time there was a little difference between the mRNA vaccines and the vaccine that we developed in India, just because the virus had changed by the time, um, because we were the ones who got hit by it first, and then it went to the Indian subcontinent. So it was already like 6 months to a year later when they got hit. So the virus had changed a little bit, but it was still very deadly, and the vaccine seemed to be very effective. And it was Novavax. So I would definitely say that we did a good job in developing it in comparison to the mRNA vaccines as effective.
Okay. And what about RSV vaccine adverse events?
So there were a couple of cases of Guillain-Barré with RSV vaccine, but when they went and looked at the matched population that did not get the vaccine, the incidence was almost similar. So it's not something that you can say, oh, these people did get Guillain-Barré because of the vaccine, because the control group also had incidence of Guillain-Barré in there. So otherwise, very well tolerated. And as I said, like there are when I shared the epidemiology of the RSV, it can actually the mortality is 100,000 per year worldwide. So a lot of people dying, a lot of hospitalization, especially kids that can get very sick with it. So in those patient populations, it will be very beneficial. And so far, it's only just one dose.
And can you get recurrent RSV infections?
Oh yes,
You
absolutely.
can. Okay. If one gets infected, even other the vaccine or oral medication, what are the chances of getting infected again? Somebody's question. I'm not too clear on the question, but I guess that's how it read.
So if you, I would assume that that's what you're asking. So if you get the vaccine and you get infected, then for COVID
Yeah,
and
after
flu,
the
you should get
vaccine,
treated.
yeah. Or oral medications, what are the chances of getting infected again? I guess the recurrence of infection.
The recurrence of infection is there, absolutely. As I said, like even if you get treated for COVID or for flu, there is no guarantee you're not going to get it again because it's just exposure. You get exposed, you can get reinfected.
Now, this Paxlovid, let's coming back to Paxlovid, right?
Mm-hmm.
How often can you take? And let's say if they took Paxlovid once already for an infection with COVID, within 6 months or within 1 year, can you give us a timeline for the use of Paxlovid, and how often can you use?
So Paxlovid is something that, yes, you can actually use it 3 times if you need to. As I mentioned, the only thing with the Paxlovid is you have to make sure that there's no interactions with the other medications that you're taking, like cholesterol medications, blood
Yeah,
thinners. So
statins and aspirin.
that you have to be very careful about. The most of the times though, if you get a COVID infection, it does boost your immunity because it's your own body fighting against it. So you get like a pseudo booster effect. So the second episode, if you get within 6 months, should not be actually as severe. So a lot of it also depends on what your symptoms are. If you feel like that you're really sick, then you should start the Paxlovid. But if you think that it's a mild infection, then it would get better even without the Paxlovid, and you don't need to take it.
So milder infections you wouldn't suggest to start in a rush, even though they
Yes,
have other medical problems, right?
absolutely. Because if, as I said, like if it is a recurrence within 6 months, you should still have some immunity from your prior infection, and your current infection should not be as severe.
What do you think about this Tamiflu? You know, not many people are really fans of getting Tamiflu. And when you compare the side effects, when you get just the flu symptoms, you kind of let it go away by itself, you know, take some binge on your vitamin C and boost up your immune system. Don't you think the Tamiflu antiviral medication is like a big gun treating a little flu? I know,
So,
unless they're elderly and they have
yeah,
been exposed, and you're trying to prevent the pneumonia and all the other things that, not to go into the hospital type of thing, right?
that
So,
is
how
true.
would you talk in favor of Tamiflu or not in favor?
So I would suggest like most of the pediatrics actually do not recommend taking Tamiflu because the kids are resilient. They can get better very quickly, and they actually recover quicker too. So what I would suggest is if you are elderly, then I would strongly suggest that you should take Tamiflu. Or any other medical conditions, like if you have any underlying COPD, bronchitis, bronchiectasis, all those like chronic lung conditions, strongly recommend you should take Tamiflu. If not, and you have milder symptoms, within 2-3 days you're feeling better, then you don't have to take Tamiflu. But I'm a little biased because I do mostly inpatients.
Yeah.
I've seen people dying, young people dying with flu. So that is one of the things I would keep in the back of the mind.
So, what would your suggestion be to our population, like Indian population, and especially this is because we're giving you the health and wellness type of thing. You know, they do not like to follow rules. They come into because we have groups of people, and during festival they're like, you know, when you tell them wear a mask and things like that, they get really mad. What would your simple advice be in terms of prevention? You know, especially you're in crowds, you have to worry not only yourself about other senior citizens or other people who are coming in, children, and like I think most people have gotten rid of the mask right now. Am I correct? So,
Yes.
like you said, you know, the droplets, even after the infection is gone. So you're coughing, you're sneezing, you know, and it's a bad habit. You don't even cover your mouth. So, just in terms of education, how would you kind of give some suggestion for our Indian friends?
What I would say is, it's like what we want for ourselves, we should do the same thing. So if you don't want to get infected from other people or your family members, your small kids to get infected from other people, we have to do the same thing for others and be cognizant because a lot of all these viral infections are basically spread from close contact and a droplet. So there's not much preventive things that you can do except cover your cough, wear a mask, wash your hands frequently. If your kid is sick and you're cleaning their noses, wash your hands, Purell their hands. Those are the things that you can do to prevent it from spreading and also getting other people infected.
So, from washing hands, I think I kind of let me go back a little bit because we all come from the background. In the Vedic times, right, there was incredible knowledge about actually, if you go back to Samudra Manthan, you know what Samudra Manthan is, right? Where the Amrit came
Yes, yes, yes.
and Mahavishnu takes the Amrit and tries to give it to all the Devatas. Since that period, that era, we have talked about wellness, hygiene, and how to take care of your mind, soul, body, and all that, So it's incredible how they did in those days. They experienced, they explored, and I think they really did. The rishis have done some great research. And during the COVID season, this temple, the Hindu Temple Society of North America, under the leadership of Dr. Uma Mysore, had followed such strict rules that the temple daily activities, the Nitya Puja and all was continuing, but very strictly as per the CDC recommendations, the temple remained closed. But also, I think how to run an organization like this, I think a book has been written regarding that. We should congratulate Dr. Uma for really following the instructions during the COVID time, and for the staff, for everybody, even the visitors who came after they were allowed, like they had to come with a mask in a row, only 5 people at a time, and outside the security guard would give. And also, almost for a year, I remember, every evening after the Arati, 7:15, we read a mantra. We chanted a mantra along with the priest, every single day, 7:15. And they had a collection of almost 100 chanting. You will be surprised and amazed. Every single chant that they picked, the priests, was related to health and wellness. Like the top of the example would be some of the common that come to my mind right away is the Dhanvantri mantra. Dhanvantri, that is like Mahavishnu carrying the Amrita Kalasha. Mm-hmm. And Dhanvantri mantra was very popular. Sri Vaidyanath mantra and Sri Devi mantras, several. So each day they picked up a new mantra and we recited for 30 minutes. I somehow, maybe you may call it a blind belief or whatever it is, I think it was a very, very good vibration, and it motivated people to be on the right track and follow. And this washing hands goes back to our ancestors. Stay clean, wash your hands and feet, because we didn't wear shoes in our country in those days, So cleanliness was next to godliness, I think, is a very true representation of our culture, as we go back years ago. And I just thought I would say that because I'm always amazed what my grandparents taught me, growing up. And it comes back from the Vedic age. And some of the chanting that we did really shook me up when you read. The COVID virus, it was on YouTube. The structure actually was presented in one of the books. Srividya is here. One of the Vedic literature, I think, they said they even timed it, like in this Kali Yuga and so phase. Something, they called it, I don't know what they call, like the Sukshma. Sukshma means very small thing that they could not see with the naked eye, will be there, and they talk about the epidemics and how you control it in a natural way without the vaccines and medications. Something that really is so intriguing, and that shook me up during the COVID season when we all sat at home and when you had a chance to read all this. So we should be proud of our culture.
Absolutely.
And the knowledge, Go
yes,
ahead.
I remember like my grandparents would not allow us to drink water from the pot until you wash your hands, soap and water. You could not touch that. So I think the hand hygiene goes long back. Also, like the yagyas and in all these yags we do, the fumes from that actually makes
the ingredients,
the ingredients that, yes, exactly. So definitely our culture is very rich, and it is actually very, the knowledge that is in there, if we continue to follow it, we can actually not need a lot of medicines and be healthy without the medicines, actually.
Yeah. And just by doing yoga and meditation, you build up your immunity, right? That has been proved.
Absolutely.
Beyond doubt, I think. I think the Western world is following more of the traditional values
And
rather
we are
than
forgetting it.
we are trying to ignore and forget. But I think we have to start a movement here amongst the youngsters, like to connect the Vedic knowledge to the current medical stuff. So there'll be to strike a balance. And you're from the younger generation, right? So probably we can somehow start a project of that sort, right? Striking a
Yes.
balance. Yeah.
Absolutely. I
Yeah,
think
of yesteryears to the modern thing, and how they are equally useful even to the present day.
you're absolutely right.
Yeah. So without, I think we've almost come to the end of the questionnaire. So anything else? What was this wastewater surveillance you said? I know I looked at that graph. I just wanted a clarification.
So it's like the sewage water.
Uh-huh.
That's because you shed a lot of these viruses
In
in the stool and urine and stuff like that. So that's how they figure it out how much is the activity of the virus in the community.
and they actually measure that?
Yeah, yeah.
Oh my God.
That's how they do most of the time actually. That's how like the bird flu that is
Yeah.
going around.
Yeah. Yeah.
That's how they figure out that it has been around already for 6 months before we started reporting it.
Uh-huh. So it's not there. So, but this is going on an ongoing basis. That's what I meant. I didn't think
Yes,
that it was so
yes.
serious. Okay. Okay. Pranisha, I think it was really your knowledge. You made it so simple, actually, for a difficult topic. Everybody thinks, oh, flu, COVID, but almost every other person gets sick, right? So this information was very, very useful and extremely helpful to our devotees. And on behalf of the Hindu Temple Society, I extend my gratitude and hope we'll have many more lectures like this.
Thank you for having
and
me.
congratulations and good luck and with your career. Okay,
Thank
we
you so
feel
much.
proud. We feel proud that a young physician like you has done such good work.
Thank you for having me and namaskar.
Namaskar. Namaste.